Hello, friends. As a student of Ayurveda or any other holistic practice, you may come across many clients diagnosed with high blood pressure. Let's get a very basic, simplistic, bird's eye view on physiology behind blood pressure. Let's meet at the blackboard. Here is a very simplistic way of looking at the physiology behind blood pressure. Let's take a look at the components first. We have the heart, which is pumping the blood into the blood vessel. The blood vessel is surrounded by smooth muscle, and we have kidney and we have liver. Think of blood pressure as the lateral force against the wall of the blood vessel. You could imagine if the blood vessels constrict from the help of the smooth muscle, the lumen gets narrower, there's going to be more force against the wall of the blood vessel. So that's one thing that's going to increase the blood pressure. You could imagine if the heart is pumping a lot of blood right into the blood vessel, there's more fluid in here, and that's going to increase the lateral force against the wall of the blood vessel. And a third thing, as the blood vessel bifurcates and gets smaller and smaller, when we are at the level of tiny blood vessels, known as arterioles, if they're constricted, there's going to be like a traffic jam for the blood flow, and there's going to be more blood backed up, and that's going to increase the pressure. It's the job of the kidney to monitor perfusion, which is a supply of blood to the tissue. If there is a low blood pressure, kidneys are going to send a messenger, and name of the messenger is renin, because the medical term for kidney is renals. The messenger is named after the kidney, renin, and this renin goes to the liver, and it's going to wake up a sleeping dog. The name of the dog is angiotensin. The medical term for a blood vessel is angio, and tensin is to make sure they constrict. So the sleeping dog here is angiotensinogen. This is going to wake up another dog called angiotensin 1. That's going to wake up next dog. His name is angiotensin 2, and that dog is going to come and bite on the smooth muscle, making it constrict. So a very simplistic way of looking at how the kidneys are going to increase the blood pressure. So that same dog we just bit here, his name is angiotensin 2, and that dog is going to release something called aldosterone, and he's going to bring back sodium and water, so the kidneys will make sure there is more fluid coming back to increase the blood pressure. So a quick review. Blood pressure is the lateral pressure against the wall of the blood vessel. This is due to the amount of fluid or blood that's pumped by the heart. It's also due to the size of the blood vessel. If the blood vessel relaxes, there is a drop in blood pressure. If the blood vessel constricts, there's an increase in blood pressure. And the peripheral vascular resistance since the kidneys are realizing there's not enough perfusion going on, enough blood supply to the tissue, one of the things you could do is make sure your client is well hydrated so the kidneys do not have to work so hard to maintain the blood pressure. Now, staying hydrated is not the cure for hypertension, but it's going to help the kidneys compensate for the blood pressure. Hope this video was helpful. In the next video, let's go a little bit into the details that I just mentioned here and some of the pharmaceuticals that will be used to help control blood pressure.